Hi everyone, this video is serratus posterior superior and serratus posterior inferior. Okay, so we're actually on page 216 now in your book. And we'll go right to the share screen because serratus posterior superior and inferior look almost identical, except they're on opposite sides of the ribs. And obviously they have a cousin, serratus anterior, right? And of course, since this is a serratus muscle, it is going to look like it has a serrated edge, right? Over here. So let's get started. All right, these are kind of opposites, right? You can see that in their fibers. One goes this way, one goes this way. So this, of course, is serratus posterior superior, and here is serratus posterior inferior. Now, serratus posterior superior is partially deep to the scapula. You can imagine the scapula would be right here, okay? And it's deep to rhomboids. It is not the deepest muscle in the area, so it's somewhere in the middle, okay? This one, serratus posterior inferior, is deep to the thoracolumbar fascia. So this one is going to be rather difficult to palpate. Maybe we'll get it towards its attachment on the ribs. This part is just too deep, okay? And there's a lot on top of it. So we may or may not be able to palpate both of these, or just have to see. They're thin, they're very thin. They're kind of like trapezius in that way. So typically we're going to be able to feel the things that are bulkier that are around it rather than these muscles in particular. Okay, so posterior superior originates on the spinous processes of C7 to T3, so SPs C7 to T3, and then inserts on the posterior surface of the second through the fifth ribs. So if we are visual people, we write, instead of second through fifth, we write 2 through 5, right? Posterior surface ribs 2 to 5, right? If we have those numbers, maybe it's a little easier to remember. Now, because of its position in somewhat of an oblique angle, it's actually going to help elevate the ribs during inhalation. So this is going to act with the external obliques, or not the external obliques, I'm sorry, external intercostals. It's going to act with the external intercostals, okay? Now, serratus posterior inferior, this one's going to originate on the spinous processes of the lumbar vertebrae, specifically T12 to L3, okay? Its insertion is also on the posterior ribs, but obviously it's going to be a lot more inferior. So we have posterior surface of ribs 9 through 12. Okay, so again, if you're writing out the numbers, it might be a little easier to remember. Since it has a completely different angle, this one is going to depress the ribs during exhalation. So this one is going to act with internal intercostals in exhalation, okay? So these are accessory muscles of respiration. We did a video on the diaphragm and the intercostals. Those were also muscles of respiration, diaphragm being the primary muscle of respiration. And then we have accessory muscles of respiration that include serratus posterior superior and inferior here, okay? I just didn't want to do all of them in the same video. That was really it, okay? But these guys assist with inhalation and exhalation, okay? And that's about it. if we look down here, I do want to show you this real quick. Just give you an idea of where these are. So if you're palpating on a partner, the best place to palpate superior would be closest to the rhomboids in between the spine and the scapula. Okay. And then palpating inferior, again, you're kind of going to be able to feel it along the edge of the ribs here. If you move your fingers laterally, you might be able to get it here right around the 12th rib, just a little superior to the 12th rib. Okay. All right, so accessory muscles of respiration, serratus posterior, superior, and inferior. That's it. Have a good day.